Okay, I'm going to talk about the top 7 hair loss options, and we'll begin with the one everybody comes to ForHair regarding initially, which is hair restoration surgery. Now, this is the only certain way to restore your hair. It has been told to us for many decades that this is a permanent solution, but you have to remember that even grafts will thin out over time. So the most important thing to remember about hair restoration surgery is that you will need some form of maintenance therapy after your procedure to maintain your hair. And that is because hair loss is progressive, and it's progressive even in the grafts that we move to the top of your head. It seems to be more progressive in individuals with more extreme degrees of hair loss when they present, meaning those individuals who are already a Norwood Class 6 by the time they're age 30. Now, the second best way to restore your hair is with a concealer. And these concealers consist predominantly of ground up wool fibers, which you shake onto your hair. And you can also get a waterproof based product that you apply to the top of the scalp. And the advantage of this product is that it will allow you to still go in a swimming pool or to take a shower, and you will come out and still have some influence from the concealer. With the fibers, however, you need to add some form of hairspray to prevent the fibers from blowing out if it's a very windy day. But these can be a very effective way to help conceal your hair loss. Now, the big downside is you have to have hair for these concealers to work. Otherwise they will not work. Something that is probably not as popular today as it was in the 1980s and 1990s is the hair replacement system. Now, they came up with this term system because the term wig was so negative. And people always thought of wigs as being something that was just really ridiculous. But in the 1980s and the early 1990s, most of the work was still plugs and scalp reductions. And all these procedures were very unnatural in appearance, and therefore wigs were a good solution for a lot of individuals. Now, one of the big downsides of these wigs is that they have to be maintained. You have to replace them on a regular basis. Let's say every month, maybe every 6 months, but certainly once a year. You need to replace these systems. Wigs have come a long way. They appear much more natural today, and they're much lighter than they used to be. But they also are like wearing the same clothing every single day. Now, this clothing will start to stink, if you will. And even though you can jump in the shower with your clothes on and get out and dry them off, they're not going to look as good after 2 or 3 showers as they did when you initially had it coiffured and styled and cleaned at your wig salon. So you got to remember that they're going to have an odor, and that you're going to have to replace them, and that they start to look bad the more you wear them. And certainly if you swim and get out in the sun, they will fade. And then that leads us into medical therapy. Now, this is an excellent option for many individuals, especially young patients who want to avoid surgery or aren't quite certain they're ready for surgery, or even as a maintenance after you've had a surgical restoration. So medical therapy is something you want to do, or you certainly want to look at it. Now, not everybody is a big fan of pharmaceuticals, but most of these medicines are pharmaceuticals, and they can have side effects. the most common of which are a decreased sex drive, an inability to have or maintain an erection, decreased semen volume, and even some enlargement in the breast, which we call gynecomastia, which is the formation of breast tissue in a male. So these medications, the most popular would be Propecia, which now is available generically in the form of finasteride. You can take this orally, and because it's generic now, we can prepare in a compounding pharmacy a topical version of finasteride. And we found that when you respond to finasteride, not everybody does, but when you do respond to it, the topical therapy is much more effective than the oral therapy. I saw only rare instances where I saw significant improvement from oral therapy with Propecia or finasteride, and I saw many, many more outstanding responses from taking topical finasteride. Now, you have to start these when you have hair. Once you've lost all your hair, the only solution is going to be that hair piece or a hair restoration procedure. And not everybody wants a hair piece. And, once you put that hair piece on, you've got a fuller head of hair, and the day you took it off, you're suddenly bald. So you're going to look a whole lot different the day you decide you don't want to wear that wig anymore. So with these medical therapies, we're trying to maintain your hair, but you got to have hair. Another common form of medical therapy is minoxidil. This is probably the most common form, and it's been available over the counter as Rogaine for many decades now. And it works only in about 40% of the population. It's indicated for hair loss in the crown or back of the head, but it does work in the front, top, middle, back. It just wasn't studied in the research papers for a response in the back, the front of the head. So then we also have spironolactone, bicalutamide, latanoprost, betamoprost, and of course there's also dutasteride. And some patients will respond much better to dutasteride, especially topically, than they will to finasteride. Then rolls into the next option, which is cell-based therapy. The cell-based therapy utilizes your cells predominantly. We can have off-the-shelf versions, but predominantly we want to use your cells. These are autologous, meaning they come from your body. And the most common form is platelet-rich plasma. Now, as you know, I've preached this for some time. Most physicians will take the cheap route and the uneducated route when it comes to PRP. And these forms of PRP will not work. You have to have the appropriate concentration of growth factors. And in order to get this, you have to have more platelets. And the only way to do this is to concentrate the PRP much higher. Now, the other form would be to use your adipose stem cells or your bone marrow stem cells. The bone marrow stem cells would come from the bone marrow. We would pull out your bone marrow and then process this into the cell-based solution. And then we can also take out your fat and then remove the fat globules and the oil and turn it into a cell-based, stem cell-based therapy that also contains growth factors and cytokines, very similar to PRP. But these stem cells from adipose will help maintain the influence potentially for a much longer period of time. In fact, when we use fat to rejuvenate the face, the response continues to get better up to the 3rd year following the treatment, and then it is maintained much longer. With the PRP-based systems, they probably should be repeated every 6 to 9 months. We don't really know if 6 is better than 9. If you want to be on the safe side, I'd probably go every 6 months. So these are the 3 most common forms of cell-based therapies. And that leads us into natural therapies, or what I would call mechanical therapies. Natural-based options might include acupuncture. And some people believe acupuncture is a method that we can use to treat hair loss. I don't particularly agree with these experts, but you know, there are people that suggest that it may work, and there's some that say it might help in alopecia areata, but I'd much rather treat this with a cell-based therapy like PRP and adipose stem cells than I would with acupuncture. And that's for resistance forms of alopecia areata. We also can help minimize the progression of scarring alopecias with cell-based therapies, especially the adipose. But when we look at natural and mechanical options, a mechanical option might include microneedling. It might also include something called sonophoresis, which is the use of ultrasonic sound waves to stimulate the hair follicles. We can also use ultrasonic delivery systems like the Alpharetta to induce hair follicle neogenesis and increase the size of the dermal papilla, which increases the diameter of the hair shaft. And we can also deliver through ultrasonic energy things like growth factors and minerals and vitamins that will stimulate the hair follicle. In terms of natural medications, we have Viviscal and we have Nutrafol. Now, Viviscal and Nutrafol both have a marine-based or fish-based collagen, and there's a slight difference between the collagen from land mammals and fish. And, you know, for some reason, the fish-based collagen seems to be more stimulatory to the hair follicle. They also contain vitamins, and they contain certain minerals and biotin. Biotin is like vitamin B7, and it's necessary for some enzymatic processes. Collagen makes up about 80% of your skin. And of course, skin is where we find the hair follicles. It also is found in connective tissue, so it's very useful, very important to joints. And therefore, collagen is something that seems to play a role in hair follicle formation. And one of the most common natural options out there is saw palmetto, which is a natural DHT blocker. And everybody knows DHT has some sort of influence or implication in hair loss. And that leads us into hair multiplication and hair cloning as the final of the 7 topics I'll bring up today. These are by no means exhaustive, but they are 7 most common. And hair cloning, we've been talking about this for over 30 years that I've been involved in hair restoration surgery, and it's been the same topic, the same phrase all 30 years, and that is that hair cloning is 5 or 10 years away, and we've been saying that for over 30 years. Now, we have made progress, and Stimson, which is a research-based institute in San Diego, has purchased the research technology from Adirans, and Adirans had purchased the research technology from Intercytex. So now that we're on the 3rd generation of this, we also have a group in Japan that claims to have made significant progress in terms of hair cloning. But hair cloning is a complex process. You know, we have the interaction between mesoderm and ectoderm. These are two of the embryological tissues that form the entire human body. And so there's an interaction between these 2 cell lines, and nobody has quite figured out the appropriate interaction. At what point do we deliver this protein? At what point does this tissue respond with this protein? And it has to be in, let's say, the exact appropriate sequence in order to form an entire hair follicle. And there's been more success in mice than in humans, and that's simply because you can almost look at a mouse and it will grow hair. So we've done better with mice than humans, and we're a long way off in humans. Now let's talk about hair multiplication. Well, you know, the best way to solve hair loss is to turn the hair follicles back on that you have on your head. You haven't lost them. They've just miniaturized to the point you can't see them. So just turning them back on is going to be a great solution, but we also have the possibility of hair multiplication. And what we've done at ForHair is we we found a way to get some follicle regeneration, which is a form of hair multiplication in the donor area, using extracellular matrix after we perform the FUE procedure. And that's just stimulating the stem cells we left behind following the removal of the hair follicles to regenerate a hair follicle in the extraction site. We may get one follicle back, we may get three. But more recently, we've come up with a new protocol to treat the donor area where we're following precise locations over time. And thus far, we found that we are able to regenerate hair follicles using our new proprietary protocol, and that at times we are able to have more hair growing in the donor area following the FUE extraction process than we had before the FUE procedure. So that's pretty exciting right there. So these are the 7 top hair loss options. And of course, I started with hair restoration surgery, and over 30 years of experience treating hair loss, I now am firmly convinced that a surgical solution alone is not a great option. We have to combine surgical solutions with some of these other options, and I would say that medical therapy and some form of cell-based therapy are the 2 best options to help you maintain your hair. You can think of hair loss as an aging process. Your hair gets older, and as it gets older, it ceases to grow. It thins out over time. And in fact, all men and all women will start to thin at age 35. So the first line of therapy is to start with a cell-based therapy or a medical therapy, and start this as early as possible, because it may help you prevent surgery. And if you've already let it get away, any surgical solution will go a lot further and last much longer if you institute things to maintain youth in your hairs. Remember, you're getting older every year, but if every year I can make you 1 year younger, you'll never age. And that's one of the objectives we have for hair. But with hair, we are able to even push the clock back. We can make your hair younger. So this is one organ-based system where we can actually turn the clock back. And think about combining multiple avenues here to treat your hair loss, because you're going to go a lot further with multiple combinations than you will with one single option. Thanks for listening.